Eastern Maine Medical Center Transfer Center. This is Megan.
The Transfer Center was established October 12, 2009, so we're at our 10th anniversary, is really the means by which we go ahead and broker, facilitate, and choreograph the movement of patients into Northern Light Eastern Maine Medical Center for patients that need to have a higher level of care. Prior to the existence of the Transfer Center, going back all the way to 1988, when I came here as Chief of Emergency Medicine, transfers were a bit haphazard. Calls would be made to the emergency department, emergency medicine physician on duty, or they would be made to individual physicians on the medical staff of Eastern Maine Medical Center. In so doing, the placement of the patient had to be arranged for, as it does now, but frequently it was not in a systematized fashion. Well, over the last 10 years, our volume has virtually tripled. We are basically receiving about 15,000 transfers or patient management calls per year. So we've gotten very, very busy. In addition, of late, we have tethered the system hospitals through the transfer center with the demands for patient care throughout the region. We also have partnered progressively with Lifelight of Maine so that if patients need critical care transport, we've been able to go ahead and deploy assets as quickly as possible. We've evolved considerably. We've refined our processes. Our staff has become truly excellent at what they do.
The Transfer Center has been an unqualified success and resource and blessing for me from the perspective of a rural health provider. One of the biggest downsides of rural medicine is it is very single-threaded. Most of the time that I'm here and at work, it is one doc, one nurse. It doesn't take more than one sick patient to maximize our resources. Transfers used to have the potential to occupy a lot of time at a time when I didn't have time to give. The focus of the Transfer Center from day one was very much, we are here to help, we are here to make that available. We are starting from yes. It's not about the doctors and the medical resources in the conversation, it's about what the patient needs.
It's very difficult to recruit physicians here or surgeons, so we're constantly struggling with that. And our service model has eroded because we just can't come up with the personnel to fill the spots. The way I've used the Transfer Center is for the obvious reason, Grandma Smith is having a heart attack, she needs to transfer, but also for practice questions. So I've used it for that kind of clinical discussion. The thing that the Transfer Center really facilitates for us in a small town like this, where we call down and say, I've got, Grandma Smith is critically ill, I need to talk to a trauma surgeon. They'll call back with the appropriate person. It gets me off the phone and attending to the details of their care so I can pay attention to what's going on with the patient in real time. It's a really great service, I think, to help us.
The fact that I have to think about it, to remember the Transfer Center rule is a success. That's exactly what it should be, because I'm not remembering the 45-year-old who came in with a dissecting aortic aneurysm. I don't have to remember that, oh, that took me 6 phone calls and a half hour of time. I made one call to the Transfer Center and said, I have an unstable patient who needs to be there by helicopter 10 minutes ago. And the answer was, yes, we'll get things rolling. You'll get a call from the right person next. Great, thank you. Hang up, go back in the room. That's the way it should work, and that's fantastic.